Did you wash your hands after leaving the convenience? Did you know that thousands of diseases are prevented when your hands are washed properly? Washing your hands properly and making them clean does not only keep you and your family safe, it also saves you billions of naira. How often should you wash your hand? Good evening. Welcome to Sound Health on Lagos Television. I am Olasunbo Modupe. Today we are taking a look at the power of clean hands. Stay tuned. The conversation begins after this break. It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Adiola Ali. She is the founder, OneHealth. She is also a health equity advocate, multi-licensed pharmacist, and health technologist. And she is going to take us through the power of clean hands. Adiola Ali, thanks for joining us this evening.
Thank you so much for having me. Glad to be here.
All right. This small but powerful routine was emphasized during the COVID-19 pandemic. It's not as if it is a new routine, but it was emphasized enough during the COVID-19 pandemic. Tell us, how would you rate us how would you rate hand washing in this part of the world?
In this part of the world, so in Nigeria, I would say obviously the COVID-19 changed a lot of people's perspective on hand washing, right? Where, people had hand sanitizers, but that probably lasted as long as the pandemic. And we find that a lot of people have reverted to their old ways. To be honest, I do not have the statistics, like fully of the, out of 10 or out of 100%, how many people follow these particular rules, but I would imagine that it's more followed maybe in the urban areas versus maybe like the rural ones, and also depending on the access to clean water and hand sanitization. But I know there's still a lot of room for improvements for sure.
All right, tell us, what is the power of clean hands? How powerful is this routine?
I mean, absolutely powerful. I mean, clean hands. The phenomenon of clean hands, or I would say the impact of clean hands, was really discovered like many years ago, like in the 1800s or so, when a doctor found out that there are two words. There was one word, this is back in, I think, somewhere in Europe, that there was one word that during delivery, the children came out safe, the mothers did not die. And then the other word, right, there were medical students that had just finished going to the mortuary, but they didn't wash their hands. Versus the midwife watch. So we found that there was a stark difference between the mortality rate, and that's how the whole phenomenon of, okay, let's test this out and see if everyone should wash their hands, would things improve? And that's how it kick-started. So since then, I mean, it stopped for a bit, and it came back again in the 80s, where it became mandatory in a lot of countries. And we found out that it saves lives. I mean, because it saves infections, it saves us from getting respiratory infections, diarrhea, and in many others.
All right.
So clean hands are powerful.
All right. Talking about the medical health workers, now health workers generally, hospitals are known for preventable diseases, centers for preventable diseases. Unfortunately, health associated or hospital associated diseases are on the increase, are on the rise. How can we avoid this bad development? It's bad, if we can put it that way.
I'll say the first simple thing is really public awareness, right? Obviously, in these institutions, you have to think around what are the policies that guides, operations in a hospital, if you're talking about hospital. So do we have a patron that is in charge of health and safety? Are they doing audits regularly? Do they have all of these flyers outside the hospital in front of their doors? Do they have hand wash basins and things for them to wash their hands, and this sanitization station? Because if you don't have all of those infrastructures, you cannot now condemn people if they don't wash it, right? They don't have access to that in the hospital. So I'll say public awareness policies will definitely influence and impact, adherence to, using these procedures like washing hands and sanitization, like with alcohol and, sanitizers.
Okay, talking about the types of hand wash now, which is much more effective, hand wash or hand rub?
Oh, hand wash, 100%. Because think about it, when you finish eating your amala and ewedu, it's not hand sanitizer. Hand sanitizer that will remove it, right? Not all microbes are germs, right? But all germs are germs. So some microorganisms sometimes are not being able to be taken off if you have actual things on your hands. So you have to actually physically wash it off. Also, things like pesticides, chemicals, sanitization, which is what you call hand rub, right? Like hand sanitizers, will not be effective. And also, all hand sanitizers have the same level of alcohol in them. It needs to be over 60%. So to be preferably, if you ask me. And there are a lot of fake products out there that claim to be effective. So washing your hands, does the trick. I think it's a lot better than hand sanitizer.
Because I know some people actually adopt what is convenient, not what is right. And if you look at situation at times, all you need to do is just use your hand sanitizer immediately. Let's look at hand washing itself now. How often should you wash your hands, and can it be overdone?
I don't think it can be overdone. Obviously, overdone would mean maybe you're overwashing it, but just use hand cream if you're thinking of drying out your hands. The common times where you're supposed to use your hand wash is after you go use the restroom. That's 100% important because you're touching different things. And, the bodily fluids and what comes out of your body is actually heavy. It contains a lot of, microbes, right? So you do that when you eat, after and before you eat. When you're sick or when you're around sick people, ideally when you're in the hospital or treating sick ones, and when you've been outside indoors, outside and you're coming back indoors, so you want to make sure that you wash. Those are the examples of when you really need to wash your hands. Amongst others, if you have heavy particles and you're trying to touch different things, you wash your hands. But like you said, if you do not have access to clean water, it's very, very important as well. So if your water is dirty or your water is cloudy and things like that, you might not be adding to your hands. So if you don't have access to clean water, sanitization, hand sanitizers with 60% alcohol or more can help reduce, the contamination on your hands, for sure.
All right. Hand washing is also a part of infection and prevention control measures put in place by the World Health Organization. Do you actually think we've made enough efforts towards achieving this goal of hand hygiene?
It depends. I would say that at the national level and WHO, if you go online, you see a whole lot of information, flyers disseminated about wash your hands, wash your hands. I think it's more of the adoption issue when it comes down to the granular level. So to your home, do you do it? I don't have data on what you do in your house, for example. In the hospital, do you do it? So it's like adoption, like are people adopting it? I would say for the most part, people are aware. I think it's in our culture. Growing up, we've always known to wash our hands. It's just making sure that you remember all the time to continually do this, and you have systems that checks that it's being done as well. So yes, it's in our nature somehow. I've always known to wash my hands. It's about, is it consistent, and are you ensuring that you are checking to see that those policies are being followed on a granular level?
All right. Your response earlier, you mentioned that the requirement for, you pointed out the requirement for hand rub. It has to be about 60%. Does this apply to your liquid soap or your bar soap? What are the requirements you need for hand washing if you're going to engage in this routine?
hand wash, the soap is soap, liquid soap or bar soap, because it contains the ingredients for it is surfactants to take off the actual physical dirt and water, that's fine. With alcohol, on the other hand, it works in a different mechanism, right? It works by decontaminating because of the sterilization of the alcohol. So alcohol is 60% of alcohol. Hand washing is just your soap, regular soap. There's no fancy, there's no special soap, soap that can rub extra, soap that can rub. There's just soap and clean water would do the tricks. So that's why it's a lot easier to access. I mean, obviously the clean water now might be the challenge in some parts of the country. That's why you have to look out for making sure that it's not cloudy, right? And it's clean. And then you leave it on. Also, even the way you wash your hands, if you're using tap, so when you wash your hands, wash it up for 20 seconds. Ensure that you rub at the back, inside it. Make sure that it's dry up. You can use a tissue paper or a hand towel to close up the tap so you don't contaminate again. And then keep going. So that's pretty much it. But yeah, there's no special soap to wash your hands.
Okay, can it be excessively done? Because I know some people are obsessed with hand washing, they are obsessed with staying clean, and I've read somewhere that it is not also good or advisable to wash your hands too often, that you'll be prone to some diseases and bacteria. How true is this?
Me personally, I mean, obviously anything in excess is excessive, full stop, and that may be less of or affecting your physical health, but more of a mental thing, right? So if you're excessively washing your hands, are you excessively doing other things because you're prone to excessive behavior, right? And in totality, you want to curb anything excessive. I wouldn't necessarily say that anybody, if it's isolated to just washing your hands because you're trying to be clean, then you want to say that have your hand cream as well so that you moisturize back and you're fine. But anything excessive is excessive, full stop. I don't think there's any special article that says from a health perspective, if you're a normal person that is not exhibiting OCD, that washing your hands is excessive. So no, I'd rather you wash your hands very well. Have your hand creams for sure.
Okay, you just advocated that we should keep washing our hands wherever we find ourselves. But some offices, they don't even have the structure in place. They just have water. How do we imbibe, before we talk about how to imbibe this culture, is there a way to penalize or sanction those that are defaulting in this regard?
Penalization. I mean, like I said, it's going to be from an institutional point of view. So if you're talking about schools, for example, or offices, then schools typically they always have like a health and safety audit. So I know that they always do that when they come in to check them, maybe every 2 years, every 5 years. And the schools themselves, they have to have hand wash for them to be licensed or have their own green license. There's some certain things that they have to have in this premises. So I know there are some. I don't know if it's been adhered to, right? And that's why it has to be a public campaign. Leaving in the hands of the government to help you wash your hands, it might not be, it has to be through a community approach. So they can do their part by having all of these regulations that ensure that, schools and institutions follow, this hand washing rule. But also from an individual perspective, which is like the public, we need to take charge of our health.
All right, then imbibing the culture. At what age should we start instilling this culture in our children?
The minute they can talk, walk, eat, even as kids, right, as babies, by the time you have like a 6-month-old starting to feed, right, we're introducing solids, and their mouth is all blah, 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 blah. You can have like hand sanitizing wipes, and clean their hands and clean their mouth. They already understand that this is not okay. I need to clean up after I eat. When they start to potty train, wash your hands, and then there's a happy birthday song that you can sing to wash your hands when you're rubbing it off. So there's all of those little cultural practices that imbibe from a very early age. And obviously as you grow, it sticks with you.
So as we wrap up now, your call to action.
My call to action is really, this is very simple but very powerful message, and I'm glad to speak about it here. I would implore everyone to really routinely wash their hands. I already mentioned earlier on, wash your hands before and after you eat, when you use the restroom, when you go outside to play, and when you're in contact with anything corrosive or dirt or those materials that can cause harm. Remember that simple washing hands save lives. It has reduced about 30% of viruses that causes cold and flu, about 20% that can cause any form of diarrhea. All around, you're saving your baby, you're saving your family, you're saving your patients that take care of. So please wash your hands.
Adiola Ali, founder OneHealth, health equity advocate, multi-licensed pharmacist and health technology. Thank you so much for putting us through on how to wash our hands properly.
Absolutely. Thank you so much. Glad to be here. Thanks for having me.
All right.
Bye, everyone.
All right. Sound Health continues with trending health report from around the world. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment. Alright, this is where we say thank you on today's episode of Sound Health. Save lives, wash your hands often. There's nothing like excessive washing of hands. You heard what our resource person said earlier in the interview. Wash your hands properly for at least 20 seconds with soap and water under running water, or use hand rub, but soap and water is actually the best. For comments and inquiries, or you have topics you would like us to treat, send SMS to 0035 826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.